Good day, and welcome to the Lake Lawrence Lake Management District Harmful Algal Bloom 2026 update. Harmful algal blooms, by other names, are toxic algae. For the last 3 months, I've been attending numerous HAB workshops and seminars given by both the U.S. Department of Environmental Protection, EPA, the Washington State Department of Ecology, and recently attended the Washington State Preseason Freshwater HAB Seminar. I've consolidated that information into this presentation so that hopefully we can get a better understanding of our HAB problems here at Lake Lawrence and throughout Western Washington. Here's the agenda that we'll be following. I want to identify and report on how to identify harmful algal blooms, what the HAB forecast is for 2026, how do we manage HABs, how HABs impact us and our pets, what are the symptoms of HAB exposure, how we treat HAB exposure in our pets, and how many people get sick and die from HABs as well as pets, and what are we doing to prevent them. Back in April of 2025, I put together a presentation on what you need to know about toxic algae that included how to identify and report HABs. So I'm going to briefly cover that, but there's a link for this video, and there will be a link at the end for that YouTube video. So what is the HAB forecast for 2026? Not very good. Washington has declared a drought for 2026. This means that we're probably going to have earlier season blooms, which we've already had. It's going to be warmer and drier weather. Higher water temps and lower dissolved oxygen levels, all which mean more likely than not more harmful algal blooms this year than previous years. Already this year, Lake Lawrence has experienced 4 toxic algae blooms, 4 February, 2 March, 5 April, and most recently 20 April, and we've not received the test results back on that one yet. So how do we manage these? We manage them through the Washington State Department of Health Harmful Algal Bloom Management Program. The Guidance for Managing Cyanobacteria in Lakes, there's a link there. Harmful Algal Blooms Toolkit, there's a link there. There's the chart on the right that goes through the process. Bottom line is, if you see visible scum on your lake, or you are ill, or you have a pet that's ill, or you know of a local neighbor that may have a pet that is ill or is sick, you need to contact your local county health department or take a sample and turn it in yourself. Once the sample is turned in and tested, it will identify whether the harmful algal bloom is above state recreational guidelines. For microcystine, that is 8 micrograms per liter. For antitoxin A, it's 1. For cylindrospermopsin, it's 15. And for saxitoxin, it's 75. Here in this area, we most have microcystin as a problem. We very seldom have the others. If it's above the state guidance or exceeds the state guidelines, then we move to a Tier 1 warning. If it's above the state guidance by a lot, then we could move to a Tier 2 or a danger level. And that would require a microcystin level of 2,000 micrograms per liter or an antitoxin A level of 300 micrograms per liter. If it doesn't meet those guidelines, then we do not post warnings, although we might notify our communities that we have a bloom and to just be cautious in and around the water. So how do you report a toxic algae bloom in our area? Report it to your local county health department. You can go to your county health department website. They most likely will have a portal to report toxic algae blooms. When you call or report, you need to provide your name, phone number, and address. You need to provide a detailed location of where you saw the bloom. You need to describe the color and approximate size of the bloom, and you need to describe the bloom as clumpy, thick, or scummy patches, or a thin film of scum. This helps your environmental health folks at your county health department or the State Department of Ecology determine if you have a bloom and whether they need to come out and take a test sample and determine how bad it is. The state has a freshwater algae control program. The program usually starts the 1st of April. It did this year and runs through October of each year. That's the time period when you have the most blooms, and our people and pets can be most impacted by it because of the warmer weather and the fact that people are out recreating more frequently during that time period. You can also go on the Department of Ecology's website and you can get on their email list for notifications of toxic algae blooms. If you're in a location where your county health department doesn't do testing, you can contact the Department of Ecology at toxicalgae@ecy.wa.gov. Provide them with a date and time, lake name and photo location, contextual and close-up photo of the bloom, and general observations, and they'll make a determination as to whether they'll have you take the sample and send them in to them, or whether they'll come out and take the sample and send them in to determine how bad the bloom is. Also on the Department of Ecology website is the Northwest Toxic Algae Map, and it shows locations where toxins are above the state recreational guidelines for a warning or danger level, or where a sample has been taken, recreational guidelines have not been met, or there's been no toxin data in the last 4 weeks. These are the signs you might see posted around your lake. The ones on the far left are normally posted on lakes or freshwater bodies that have had frequent toxic algae blooms. These are signs that are posted just to notify people of what they might experience, and if they do, to stay out of the water and avoid the scummy areas. The far right is a warning sign that is posted when algae test results show results above state recreational guidelines. As I said, 8 UGL for microcystin or 1 UGL for antitoxin A. The one in the center, the red and black, is the danger sign that is posted when toxic levels reach 2,000 UGL for microcystin. There's also some satellite imagery that you can obtain by visiting the U.S. Army Corps of Engineers HAB Explorer website. The website link is posted there. It'll tell you if chlorophyll A is present in your lake, which is the proxy for cyanobacteria. It's an interesting website to visit. It covers the entire United States. It takes a little bit to navigate the system to get down to where your lake is. How do HABs impact us? The toxins impact our entire body or all of our organs. So like I said, cyanotoxins impact most organs and body systems and can be harmful to your health. The routes of exposure are inhalation, 21%, ingestion, 57%, or direct contact, 84%. So the exposure routes and acute symptoms: ingestion are gastrointestinal, abdominal pain, nausea, diarrhea, vomiting; neurological, dizziness, numb lips, tingling fingers and toes, predominantly with children under the age of 18, because they're the ones that are most probably going to be in the water the longest and the most frequently. That's why we see these problems with children more than adults. Ingestion of fish, health effects are not well known. There are known reports of illness from eating fish caught during a bloom. However, cyanotoxins are more likely to build up in the fatty organs of the fish. Therefore, the recommendation is to avoid eating the internal organs of a fish caught during a bloom. I know most of you won't do that, but sometimes, we'll bake a fish whole, particularly, bluegill, perch, etc., smaller fish where you really can't fillet them and stuff. And we just recommend that during a bloom, you don't eat the internal organs. Inhalation, cold-like symptoms, itchy eyes, runny nose, sore throat, and cough. Dermal, you're going to have a rash, a hive, a skin blister, or red irritated eyes. Now, there's new dermal research from the University of Toledo that suggests that dermal exposure to microcystin can be more than just skin deep, especially for individuals that have pre-existing conditions like dermatitis or chronic kidney disease. The effects extend beyond the skin and can impact internal organs such as the liver and kidneys. And it can build up over time. It's not like it gets voided from your system. It stays in there. If you can build it up over time. These are photographs of different types of dermal skin problems. Cytotoxins in the upper right corner. There's no photograph there because we don't know exactly what it looks like. But you can rule it out if by looking at these other photographs saying, okay, well, I've got swimmer's itch, or I got poison oak, or I got psoriasis, or scabies, or swelling. If you're just not sure, you just want to check it out, best bet is to see a doctor. Symptoms for animals are lethargy, vomiting, drooling, diarrhea, and weakness. I'm going to point this out here, and then at the end, keep the local animals away from your lake by not feeding them. The more you feed them, the more they show up, the more they stay. For geese, it's a real problem. They poop a lot, and people like feeding them. They like seeing them on their property, but then they got the poop to deal with, and it washes into the water. And the more birds you have, the more poop you have, and the more times you're going to find a closed beach because of the heavy phosphorus and nitrogen content of the goose poop. There's a lot of things that we don't know about HAB exposures and illness. There's limited research. There's knowledge gaps. There's more research being done. So what are the symptoms of HAB exposure? I've talked about some of them. Animal symptoms: vomiting, diarrhea, excessive salivation, lethargy, staggering walking, difficulty breathing, seizures, convulsions, liver failure, jaundice, skin rashes, and death. And yes, there have been deaths to pets, even in our area, and I'll talk about that in a minute. Human symptoms are gastroenteritis, abdominal pain, headache, dizziness, loss of coordination, jaundice, kidney damage, skin rashes and irritation, eyes, nose, and or throat irritation, shortness of breath, coughing, and sneezing. So how do we treat this exposure in pets? Well, wash all contamination off their fur and start a pet poison control case. Notify your veterinarian who would induce vomiting or administer charcoal, IV fluid therapy, check blood work to guide treatment, anti-nausea medications, etc. Diagnosis is done through identifying the toxin or producing organisms in stomach contents. They pump the stomach content out, and they can have it tested to determine what it might be. They can also get it through urine samples up to a month after the toxin is ingested. So how many people and pets get sick or die from HABs? No people that we know of. Of course, sometimes you don't know why people die of different things, but people and animals are getting sick from harmful algal blooms. And across the United States in 2022, 15 states voluntarily reported 372 HAB events with 95 human illnesses and at least 102,071 animal illnesses. Nearly half of the human illnesses were among children and teens younger than 18 years old. As we all know, they're in the water the most and stay the longest, so they're the ones that are most susceptible to these microcystin and antitoxin A toxic algae. This is an overview of HAB-related animal illnesses since 2019 to 2022 over a 4-year period. For dogs, all of the illnesses were for dogs, not cats or any other type of domestic pet. Livestock, it was 100% cattle. There were a lot of deaths as a result of toxic algae blooms, a lot of them with fish and bats. In our area in 2025, we had one dog death reported from a toxic algae bloom in September 2025 at Spanaway Lake in Pierce County. So what are we doing to try to prevent harmful algal blooms? Well, most lakes in Washington state have harmful algal blooms. You have to do a cyanobacteria management plan in order to do any mitigation to target this toxic algae. We're well along in our process. It's about an 18-month process. We're due to finish our process in June. Right now, we're reviewing the draft CMP, Cyanobacteria Management Plan, getting our comments back to our contractor who will finalize the plan. Then we need to get approval from Department of Ecology. And we're hoping to do our first treatment for toxic algae in our lake in spring of 2027. Why that? Spring of 2027, because that's when they recommend that you treat for the toxic algae blooms. That's when your treatment is most effective, is in the early spring. You don't want to treat during a harmful algal bloom because it's less effective, and these are very expensive treatments, over $100,000 each. So there is a freshwater algae control program by Washington State that does issue grants. Usually 3 to 5 grants a year, up to about $50,000. There's no matching requirement. We applied for one of these in 2024 and received a $50,000 grant. As you see here, the third one down on the current active grants is Lake Lawrence and Thurston County. The cost for that plan that we contracted for is about $100,000, so the grant paid for about half of it. And then there's been 4 other grants awarded recently. I'd just like to finish up by saying, do not feed the animals, the geese particularly. The more you feed, the more birds show up, the more animals that show up, the more poop that gets into our lake and water bodies, and the more times we're going to see our beach closes because of cyanobacteria blooms. So don't feed the geese. So hopefully you've gotten a lot out of this presentation. I hope you have, and I hope to bring more information to you. Subscribe to this website, to this YouTube channel. Click the button in the bottom right and see these videos as I bring them online. You have a great day.